Hello, everyone. Welcome to the last CCS Trainee Networking event of 2022. Following a very successful, busy, but phenomenal trainee program at the Canadian Cardiovascular Congress this year, this networking event would be the last CCS trainee event of the year, and is going to be about global health and missions abroad. I'm Nariman Seferban, the cardiovascular trainee and physician at the University of Alberta, moderating this event with my co-moderators, Dr. Sinaz Hatami from the University of Alberta, Dr. Najah Adrik from the University of British Columbia, and Dr. Pei Jun Zhao from the University of Western Ontario. Before we get started, please note that we will be recording the panel discussion section of this event, but please do not hesitate to be comfortable and meet and greet as many attendees as possible during the networking portion. If you have any difficulties with Remo, you can hit the refresh button on the screen. That would probably solve the issues with audio or video. And today we are very excited to have an expert panel encompassing clinical and research experts with significant experience in global missions. Our first panelist is Dr. Andrew Fagan. Dr. Fagan is a cardiac surgeon slash intensivist at the University of Manitoba in Winnipeg. Over years, he has collaborated with global mission programs such as Canadian Rwanda Open Heart Project, providing life-saving surgeries in areas of need in Rwanda. The next panelist is Dr. Phyllis Kisa. Dr. Kisa is a pediatric general surgeon and pediatric urologist. As someone who has been initially trained in Uganda, she has been very active in collaborating with local and international partners and programs to coordinate and improve research and surgical capacity in Uganda. And the last but not least is Dr. David Horn. Dr. David Horn is a cardiac surgeon at the Dalhousie University, and he has been very active in global missions in cardiac surgery, providing life-saving surgeries again in Africa. Welcome to all our panelists, and thank you so much for joining us today. Now, with that introduction, we will begin our moderated Q&A section. I would like to invite my colleague, Dr. Najah Hadrik, to ask the first question from Dr. Kisa. Thank you so much.
Thank you so much, Nariman. Dr. Kisa, I would like to ask you a question. Besides fulfilling experience of being a global mission, some may find it sometimes emotionally overwhelming. How do you cope with the fact that now some patient you see in this mission could have been treated in Canada, but you may have not have the means to do that in the mission setting? How do you deal with that feeling?
Thank you, Najah. So this is never easy, and you need to prepare yourself mentally when you go into missions, because one, you have to realize you're not God, and two, you cannot, solve world hunger, for example, and surgery is one of those things. And when it comes to things like reconstructive surgery, less is more. To balance in care more by my you have to put into
Dr. Kisa, I think we lost you. Dr. Kisa, if you can hear me, you can refresh Remo so we can join us again. Can you hear me now?
I can hear you, but can you hear me?
It just a little bit interrupted, and we lost you for a
Okay.
second.
But you can hear me now?
Yes.
Okay. Should I repeat what my response was?
If you could.
Okay. So I hope the network stays good. What I was saying is when you go for global surgical missions, one of the most important things is not to get shocked before. And we're all fortunate right now that so many people have written things to prepare people for going to global missions. Before, it's kind of like a surprise. You go and find a lot of things that challenge you emotionally. But now you need to prepare yourself mentally for all the things you're going to find. And many times you're going to find patients you cannot care for. And it's important to know that you can never solve world hunger as one individual. And the same comes to reconstructive surgery, because sometimes doing less is more, because you could do something that is a big operation, for example. And when you leave, no one can look after the complications and things like that. So sometimes doing nothing or doing very little that's able to save a life is important. But also if you think about referring the patient, because you know that this patient could get care, if the opportunity comes, you have to balance that between the patient actually getting care, which they need, but also when you take them away from the country, there's also the part that the local team, you cannot transfer those skills to them. And yet maybe the infrastructure is not there. So these are some of the things you deal with. But the main thing to remember here is when it comes to global missions, sometimes less is more. And prepare yourself mentally and you'll be able to deal with it. It can be really challenging when you know you should do more and then you watch the natural history of a disease happen, because it's not always possible to transfer a child or even to do something. You have all the skills in your hand, but you just can't do anything.
Wow. Thank you so much
Thank you.
thank you so much for sharing. This is so insightful. I know, like, as you mentioned in your answer, like sometimes like emotionally draining to do so, but thank you so much for all the work that you're doing. Uh, Now I would like to invite my colleague Bia to ask the second question to our next panelist.
Hello. I'd like to invite Dr. David Horn to the on stage, please.
You can see me. There.
Right. Hi. Thank you so much for joining, everyone. Hi. So as we heard from Dr. Kisa's insightful experiences, especially the part where less is more, gives a natural transition to our next question here. So on global health missions, how do you adapt to mission settings with fewer resources when practicing in a well-equipped healthcare system such as Canada? What part of your training and experiences do you believe best prepared you for these type of missions?
Yeah, so it is something that is, my philosophy in cardiac surgery is to be prepared. And so in going to a place to do cardiac surgery, for instance, and that goes for all disciplines in medicine, the pandemic has been good with having these virtual platforms that you can actually speak to someone that's local. And so in preparation for missions, one of the big check boxes that I go through is to see what resources they have, be it equipment or consumables, and doing that months ahead of time so that we can then start working and planning as a team how we can take equipment there, be it consumables or essential equipment needed for certain parts of the surgery, or even in cardiology, like we've had missions where we had to buy a TEE probe and rent a echo machine, for instance. And so there's certain things that you just can't do without. And so those things in planning the mission, you have to prepare and do that beforehand. So that's something that we can work on. And so the mission is not just the mission when you're there, it's the preparation before. That being said, then when you get on the ground, there's always something that's missing. And I think I was fortunate that I trained in my medicine. I trained in South Africa, even though I did my cardiac surgery here in Canada. But back in South Africa, my training, we were often used to not having all resources and then having to way how to make things work. Like a tracheostomy, someone taking a pen instead of having a scalpel, and taking out the pen part. And so that's part of the challenge of doing global health work, that you've got to think outside the box. The most valuable resource is between your ears. And so if you consider that, then for me, training, preparing for global health, if that's what you want to do, starts during your training years. And if you have the heart to do that, you always need to start thinking about, how can I do something differently if I don't have the resource? How can I diagnose clinically? Because on the diagnostic side, we're trained to be clinicians. And so your preparation starts in training actually already.
Right. Yeah. Thank you so much for your comments. It rings very true. So for instance, for residency, physical examination skills are very important. All you need is stethoscope. And at the same time, being able to make the most out of what testing and equipment one has to try to make the most impact. And when things are not present, being able to make creative solutions. So that's very, very helpful. Thank you so much for sharing your experiences.
Welcome.
Yeah. So the next, I would like to invite Sanaz to the stage.
Thank you, Pai. And thanks again, Dr. Horn, for the great answer and sharing your experience. So our next question would be for Dr. Fagan. I would like to invite Dr. Fagan onto the stage, please. Hi, Dr. Fagan.
Hello.
So our question for you is that, when you think about missions, one of the first things that comes to our mind is the sustainability issue, especially when we talk about more sophisticated subspecialties needing more resources, such as cardiac surgery. So the question is how to ensure some sense of sustainability equipment and human sources for long-term presence in those types of missions. And any ideas to achieve that for the trainees that are aiming to follow in your footsteps in that regard? Thank you.
Yeah, for sure. I think that's a really important sort of long-term consideration before someone goes on any project. On what I was thinking about this, because we got the questions ahead of time. On one hand, you might have, a project that or an intervention that's sort of low cost, high frequency, high impact, and that might have a large benefit to a large population, and maybe there's value in doing that in a one-off fashion. But I think even in that sense, you want to think about the long-term the longer-term goals. If you look at cardiac surgery, it's almost the exact opposite of that situation. So, it's expensive. It requires robust healthcare systems. It does have potential for a huge impact on an individual level. But if you look at, say, what I'm involved in, our most recent trip, we operated on 6 adults. And that has huge impact for them and their families, right? They'll get better from their heart failure and they'll lead a mostly normal life. And it's hard to overshadow that. But if you also consider that, heart disease is one of the leading non-infectious causes of mortality and morbidity, it's a very small impact on that sense, right? When you consider that there's millions and millions of people that would benefit from cardiovascular care. And I think when you look at it like that, then it really highlights how much more important it is to focus on developing, a sustainable system so that there's an ability to diagnose and treat heart disease. So if you look at our Rwanda trip with CROP, I went with David as well. He did the pediatric side. We came relatively late in the picture, so a lot of work had already been done between like different NGOs, the University of Rwanda, the Rwandan government, and a lot of really dedicated people, in Rwanda. So Team Heart is one of those organizations, and they've been going for more than a decade. And during that time, there's been the development of district clinics so that there's screening for heart disease and follow-up for anticoagulation after surgery. There's cardiologists. They've trained a cardiothoracic surgeon. There's a perfusionist and nurses experience with looking after post-cardiac surgery patients. So that's like a very robust start to walk into, but there's still a ton of work to be done before you go from that to just there's heart surgery in Rwanda. And in thinking about that, I think there's almost two aspects to actually answer your question now. I think that you need to actually, on one side, get something going. So there needs to be regular heart surgery so you can understand the needs of the system. And then part two is how do you make that a sustainable long-term thing? So if you look at our example in Rwanda, right now there's sporadic heart surgery happening throughout the year, but not on a daily basis. And I think you almost need that daily basis happening, even at just a small level, so that you can understand what supply chain issues there are, what training needs there are, and really figure out what's needed if you want to have that for the longer term, and if you want to scale it up. And around that, the other systems, like I mentioned, start to develop. I think for the second part is then how do you make that a long-term sustainable thing? And I think that's maybe the neat aspect about working with, Canadian universities, for example, is there's the potential for opportunity of developing, like mutual training pathways and things like that to support their training of healthcare needs. If you look at, again, Rwanda is my example. There's been a lot of anesthesia work with the University of Rwanda to develop mutual training pathways. Trainees went to Dalhousie, and then Dalhousie supported ongoing anesthesia there until there was enough capacity to then train anesthesiologists through the University of Rwanda. And a lot of those partnerships, I think, are what needed, but you need to know where the needs are. And I think they can provide sort of mutual benefit on both sides of the ocean, right, to share in training experiences and develop those systems. So I'm hoping as, our time in Rwanda evolves, that will be a neat pathway to sort of explore it, is how you get some mutual training going. But you really need some to make sure it works first before you start, training a second surgeon, training cardiologists, training nurses, those sorts of things.
Thank you so much, Dr. Fagan, for those insightful thoughts. And I would like to use this opportunity to thank all our panelists for sharing their valuable experiences with us today. I believe with this we conclude our Q&A session, but before we head into the networking portion, we would like to take a minute to thank to everyone that made this event possible. We are really grateful for the support and guidance we received from the CCS staff, trainee committee, and networking group leadership and members. And of course, thanks again for our awesome panelists who accepted our invitation to join us today and share their valuable experiences with us. We really appreciate it. We will now heading into the networking portion where we will all have the opportunity to chat with each other at a remote table of your choice. But please unmute your video and audio for maximizing your experience during networking. And also, every 15 minutes or so, table hopping is highly encouraged to get the chance to speak with more people. And if you had any questions or problems, please click on the help desk or chat with the CCC staff. And also, please don't forget to fill out the survey after the networking event and let us know how we did and how we can improve these sessions for our members of the community. Okay, let's then start our networking portion of the event. Please enjoy it, and thanks again for joining us.